Hey guys, it's Tim with PT Progress, and before I go to my next patient, I wanted to address a question I was thinking earlier today about new grads starting in home health. When I graduated a few years back, I really only had about 1 or 2 days with a home health physical therapist. I wasn't exactly sure what they did, but I kind of enjoyed the idea of going in and out of different environments, helping people where they were. And so when the opportunity came up to be a home health therapist on a weekend basis, I thought, okay, let's give this a try. But I was thinking, as a new grad, if you're interested in home health, what opportunities are there for you guys? And is it possible that you just jump right into a home health setting right away? And I think the answer is yes, because you're going to learn a lot on the job. You're going to learn with your preceptor. And when it comes down to it, home health is all about function and getting people moving in their own environment and feeling safe. And while you may not have all the tools of an outpatient clinic, you're going to have a lot of opportunity to help them meet functional goals within the home. But some of the barriers, I think, as a new grad are understanding what a typical day or flow would be like within the home. So you might see someone for 30 or 40 minutes, but what do you actually do in that visit? You might have some routine items like checking vital signs, blood pressure, heart rate, temperature, that type of thing. Generally, we do that initially just to see where they are. And then you might dive into a few things like walking or gait training, strengthening, functional transfers, even balance training. Or if they're a total knee replacement or hip replacement, you might work on specific muscle strengthening or range of motion. And so you might get a better idea on a case-by-case basis, but maybe in a future video we break down some of the components within a home health visit so you have a better idea. But I think that was one barrier for new grads to understand maybe how a visit is shaped, how it's structured, and how does that 30 minutes or 45 minutes that you spend with the patient, how does that look so you can get your mind around a treatment plan for the day. The other component that is a little bit elusive to a new student or new grad who's getting into home health is understanding how to document effectively and correctly within a home health setting. Typically in an outpatient setting, you might follow a SOAP note approach, which we've talked about in a previous video. But documenting in a home health setting might be a little bit more difficult to understand because of the system. So you have to follow specific EMRs for home health. And they can be a little tricky. They can be some kind of cumbersome in their check boxes. And then on top of that, you have to write skilled documentation reflecting your skilled treatment. And so that part took a little bit of time, which is why I made up some documentation templates to help myself initially, but then made them available to new grads, home health PTs, and they found that really helpful as well. So all those little things to work up efficiency are important, but getting your mind wrapped around what it takes initially for shaping the treatment visit that day, but also making it flow smoothly afterwards with your documentation, those can be the items that go unaddressed and are difficult to understand unless you're in the trenches. So hopefully we give you some ideas on how to tackle those things in the coming videos. But if you have specific questions, I'm glad to answer those. Leave them in the comments. And if you found this video to be helpful, go ahead and like it. And if you want more videos like this, I'd love it if you subscribe to the channel. And we'll see you in the next video.